We're all here.
Keller's got a minute or two.
We're going in executive session.
All right, we are live, folks. Seconds for the last two to come in here. Thank you, everyone. Welcome to the committee meeting for Wednesday, October 6th. Start off with health services committee.
Good evening, everybody. We're opening up the health services committee meeting at 6:01. I noticed we have Kim on. Kim, was there any updates or anything you wanted to give us before we go through the resolution? Yes.
Hi. Can you hear me?
Yes.
Hi. Did you want me to do an overview of COVID?
Sure.
Okay. As of this afternoon, we have 161 active cases. So that has been an increase over the last several months steadily since July. New cases today were 21. We currently have 18 in the hospital, 339 on quarantine, and we have had 81 deaths.
Thank you, Kim. Go right into the resolutions. Anybody?
Yeah, well, just one question more. Have any of the deaths been vaccinated?
Not to my knowledge, but
Thank you.
I'm sorry, what was that, Laura? I couldn't hear.
There was a death yesterday of another woman. This is the second death recently of people in their 40s. Unvaccinated.
Are they now letting you know comorbidity issues? I know when this whole thing started, it was just, there wasn't any knowledge
You can
that.
see their medical records.
I don't know, too, there was a report, and it was in one of the TV news programs about a hospital group. They came out and said that 6 of the 7 that died there that day were all vaccinated.
So that goes to the question that Greg asked about the deaths, were they vaccinated or unvaccinated? I have to double check that. But as far as I know, the majority of the deaths that we had have occurred before the vaccine was available. So I would guess that they were unvaccinated people, and I know of the recent deaths. But there's that big point that I have to get back to.
You know how many deaths we've had since this current spike, or
But deaths lag behind infections. This is not unusual. You have this peak of infections, your hospitalizations, and then the deaths are the other unattended. Especially now with the antibody infusions, we can get people to the hospital, we can give them antibody infusions, we can treat them better, doing better at treating them. But the deaths usually occur further beyond the spikes.
so do you know, like our local hospitals, Columbia Memorial, your local hospitals, do they have ample supplies of these antibody treatments?
As far as I know, if anybody needs it, their primary care provider can connect them to getting it as an outpatient.
We have a list that we put together on our public health site about these certain.
No, because it's really not appropriate for us to advise on medical care. It's between the positive person and their primary care provider, or the person diagnosing it. We don't provide medical care directly. So that's it. And they have to meet criteria to underline. Not something you can actually.
And related to the COVID as well, more specifically to the executive order that came out, we have restarted weekly phone calls with the governor's office as of last week. We got our second phone call today. Less than stellar. Right.
classified.
to be polite.
Which was the executive order that was issued on?
On the requirement for the vaccines, the staff members in various healthcare.
So is this an executive order or a mandate?
That's an executive order that came out that applies to different healthcare situations at different points in time. So the hospitals were, and healthcare facilities, provided long-term care and assisted living maybe was.
On the 30th.
Was the 30th. Ours, I believe, is the 7th. Tomorrow. And then she's already hinted now at additional ones that are going to be forthcoming. The phone calls now that we're on are specific to that order and as it relates to staffing levels. So the state has now set up what they call a command center that agencies are able to call into if they have staffing issues. They're supposedly going to be able to link them somehow to unavailable resources to help cover staffing issues.
Pat, did the legislative body of Albany give the governor state of emergency powers to do
No,
any of this?
it's not an emergency order. It's an executive order. But just so everybody's aware, we are on the phone again once a week with their office. I asked the question last week as to whether anybody was keeping an eye on the downstream effects of staffing levels that have dropped at hospitals such as our EMS system. Nobody could answer that question last week, and this week we did not get an answer to that question either. Was not addressed. There was a question that was asked by one of the assembly members, and that question was not answered either. So as I said, they've been less than stellar so far, but we are in communication on a weekly basis with multiple officials again.
So is this all still up in the air because of challenges to the so-called mandates or orders, executive orders?
We put the letter forward.
The only challenge now is the religious exemption. There is, the mandate for the healthcare workers will remain in effect. The only amendment would be, will somebody be able to get a religious exemption? That has not been, as far as I know, that has not been made.
I think it's valid that they're hearing that, or one of them anyway. There's several out there, but most of them relate to a very specific.
And there'll be more. We believe that she will pick another industry or another level of employment for the next level of mandate.
So in the call, no one from herself or the governor's office acknowledged the fact that our healthcare workers have been working with this for a year and a half. No. And they're going to then go and tell these people after a year and a half of dealing with this and being around it and exposed to it,
Being essential.
and that they're going to
The only justification that I heard on any of the calls specific to staffing was that people who are coming in for healthcare service deserve to know that they're being treated by someone who's not going to get them sick. That was the basis for.
Unfortunately, that's not true because people who are vaccinated are still getting COVID and spreading.
I know. These are arguments that have been made. There are questions that have been asked, and like I said, we got zero answers today from the questions that were asked last.
I'm curious to see the numbers of deaths that they're going to be reporting of people who were not able to get the health care that they need, who had to go to Oshkosh, Wisconsin, to an emergency room that could take them in because there's a shortage. I am curious to see if that's going to be reported or if that would be another number that.
Patty, I can't even tell you if they're monitoring that because we didn't get an answer.
Well, of course, we're never going to have that number. I mean, I know the answer to my question. I just thought I'd put it out there.
In fact, this is trickling down beyond healthcare with New York State example, you have to give your card to vaccinate twice. If not, you have to get tested, I get the exact date, once a week or twice a week at your own expense. Not through insurance, but no time off to do this. So this is, something that's trickling down.
I would be okay with a testing option.
But isn't it?
It wouldn't require us to lose staff that are providing services that we're supposed to be providing.
Yeah.
This is not just for Greene County, but for everybody. It creates a hole now and a gap in services all across the state. And there's, as we were told today, there is not resources that have been identified that are available to fill those gaps, which is what the plan was supposed to be.
Pat, besides the test for COVID, I mean, there are tests out there for antibodies, natural immunity, right? Which we're seeing now through all the research is more effective than the vaccine is in protecting people. Natural immunity is. And for the life of me, I'm sure that there's a high percentage of healthcare workers who probably have natural immunity by having to deal with it for the first year before vaccines were available.
There's some that have gotten contracted COVID and can't get their vaccine for 90 days. I know that that's been addressed. There's a host of things that have been addressed. Laura, how did our testing go that started up this week?
So we had been very busy the last 2 days, 45 people today, 55 yesterday. We tested 112 people. We have a 10% positivity rate.
In 3 days.
Yes.
So
Good. Thank you.
are they being tested because they're symptomatic?
We are asking them to be either symptomatic or they're on quarantine. We identified the first day 2 kids that were getting off quarantine that day, but lived in households with positives, turned out positive, and so they did not enter the school. So they did what we were trying to do, which is to increase the level of testing so that it takes the burden off the schools and keeps things going.
And keeps a positive case out.
But it's kind of counterproductive, because if you're vaccinated, you don't need to be tested. You
don't
can
need
still
to, but we
catch
still
it and
recommend it. If you've been exposed, we recommend even vaccinated people get tested about 5 to 7 days later. Just to be safe.
well, absolutely. But I'm just saying, as far as work, if somebody's vaccinated or they're not, they can still contract it. They can still spread it. They can both still be asymptomatic.
Right, but you have to pay you have to pay $100 and some out of pocket to get that test if you're not symptomatic. The reason for this ban is.
I understand that, but even if the person is tested or they're not tested, it's kind of like a stronghold to make somebody get a vaccine.
This isn't about vaccination at this moment. We're just trying to increase the level of testing for the community. Especially, we've heard a lot of complaints from people that didn't want to pay out of pocket for testing, that couldn't get adequate testing. So in response to that, we opened up testing.
So the funds for that, Laura, are they coming from federal dollars or state dollars on
Test
like
kits
for
we've
these
already
tests?
received. They were in our cabinets, and we are using our own staff and some volunteers.
Laura, these rapid tests, they're allowing students to return to school if they're negative. Is every school district abiding by that?
So we were on a district call this morning, and we're working on some guidance and writing from this health department to.
Yeah, that was a source of concern. In the beginning, where schools didn't want to allow the rapid tests to show a negative result. They wanted a specific PCR test. So but they do want to see it in writing. They've been working on that for about a week.
How accurate is that rapid test, Laura?
Seems very high accuracy rates with the molecular test that we are conducting.
Any other questions? Hey, Aaron. Hey, first First resolution, authorizing agreement with Greene County Family Planning and New York State Department of Health Family Planning Program Contract Number C 36272 GG.
Davis.
Davis,
Linger.
Linger,
Patty, sorry, I did have one question on this.
go ahead.
It was this large increase in dollar amount that you're receiving over last year.
This is the first increase in this contract in probably 10 years.
Okay, so,
This is a great thing.
right, so I didn't know if it was because, we have more people requiring the services, or is it just that they decided that this is what?
So this
Is
is,
this a normal thing across, besides our county, is it normal, has it been basically the same percentage increases for?
No.
so this is a competitive
competitive.
grant. Most of the grants we get, we don't apply for, they get given to us. This is an exception to that. We have to do a competitive grant application process. This is the second round of competitive grant that I've had to do. So under this new competitive process, the state looked at who is applying for this money, allocated money as in response to the application. We were very pleased because we'll use the additional money to offset the county's share of personnel costs.
So when you do competitive grants, are there strings attached?
Absolutely.
Okay.
There's metrics you have to
Well, I'm
meet.
just saying, I mean, I guess, it's supposed to be family planning or healthcare or whatever, but is the state then saying, well, you have to do it here, use it here for this and that, and
I have to provide them quarterly reports on the finances and all of the metrics that they are asking us to meet. So yes, there's specific metrics that are tied to this grant.
so, for public health in Greene County, do we have any influx of people, whether they're refugees or people who have been moved to this area that have crossed the southern border, and that they will be receiving some of these funds prepared?
This grant requires us to serve people on a sliding fee scale basis, and some of the people that we serve are documented immigrants and some are undocumented. I can't tell you when and how they arrive in the county, but they are residents of this county, and the grant requires us to serve them.
Think about it.
All in favor?
Aye.
Opposed? That's carried. Second resolution, authorizing agreement, Greene County Mental Health Center with Case University. Rivera.
Lennon.
Lennon, all in favor?
Aye.
Opposed? That's carried. Third amendment. Budget amendment, Greene County Mental Health Care Coordination COVID-19.
Davis.
Davis. Rivera, all in favor?
Aye.
Opposed? That's carried. Budget amendment, Greene County Mental Health 2018 Federal Upper Payment Limit Fund.
Davis. Lennon.
Lennon.
Lennon, all in favor?
Aye.
Opposed? That's carried. Is there anything else to come before the health committee this evening?
Yeah, one more.
My eyes.
Number five.
That's why I asked if there's anything else.
Why, yes,
Thank
yes,
you,
there is.
everybody.
It's reflected.
read it?
Just want to make sure everybody's with me. Budget amendment, Greene County Public Health and New York State Department of Health COVID vaccine response contract number C-36933GG.
Davis.
Davis? Linger? All in favor?
Aye.
Opposed? That's carried. Anything else? If not,
Motion to adjourn.
Rivera?
Second.
We are adjourned.
Thank you, David. Thank you.
Thank you. Thank you. Good night.
All set, Linda? Thank you. We call County Resources to order at 6:21. There are no action items here for the month of October, but there is something happening at the college next week.
Right, I sent you that invitation.
Yes.
I sent it to all legislators
So if anybody can make it, if you could promptly let her know or let Sean know.
by Friday.
By
Because
Friday.
there's also a lunch selection there. as well.
All right. Hopefully, people can make it and have some input on what they're looking to do there, or the direction they might be looking to go. So.
And it's at the bank too, not at college,
Right,
correct?
is that Hudson River
Hudson Bank.
Bank?
Hudson River Bank.
No, I believe there's a room named after the bank in the college.
Oh,
Because
okay.
I'll admit it,
It's a little
I sent
confusing.
Mary a request saying, can I have the address to the bank?
Yeah,
And she promptly said, it's in the school.
okay.
The cafeteria.
The cafeteria, that's what I figured, right?
Okay.
If you do it.
Anything else before county resources?
Motion closed.
Lennon with a motion to close,
Second.
seconded by Overball, we are closed.
Thanks, Linda. Good evening, everybody. I'd like to call the Public Safety Committee to order at 6:22 PM. Before I get into the proposed action items, we have Sheriff Kuzminski.
Hello, everybody. Busy month. We had 194 civil attempts, 96 civil papers served, issued 103 traffic tickets, investigated 20 traffic accidents, made 19 arrests, 2 DWI arrests. We handled 372 calls for service and made 167 traffic stops. The jail is open. All male inmates were returned to the Greene County Jail without incident. The State Commission on Corrections has granted a substitute jail order for our females to remain in Ulster County due to our staff shortage. Staffing has been challenging, but we are in a similar position to the other counties in the state. Road patrol deputies have been assisting the corrections officers both in the jail and with transports. Greatly appreciated by the corrections side, so they're stuck every day. On September 1st, 21, the starting jail population was 34. As of 9:30, it was 40, and today it was 41. Corrections officers did 27 transports, traveling 1,405 miles, totaling 47 hours, moving 53 inmates, and we have 1 state-ready inmate in our custody. It's been a relatively busy month as the courts are starting to do more. Evictions are also starting to move forward as the judges are now able to decide whether or not the tenants have proven that they've been impacted by COVID. Things are starting to move a little bit. Hope to see more.
Pete,
Well, I got-
you're at 41 males.
No, 36 males, 5 females, and 5 females.
Gotcha. So we're at 36 males in our facility. We have beds for 48, correct?
Correct.
Including the transitional cells.
So we're close.
Yeah.
The percentages, we're close of,
Technically, yeah, we could probably only take, if we're only using the male pods for males.
Yeah.
we'd probably take 43. Be maxed out.
43.
First, SCOC.
Yeah. COC.
That's
Interesting.
the way it's.
We still have the 16 cells that we can outfit.
Yeah.
But that's kind of where I'm going. Just keep an eye on that. That's something we need to talk about.
And they changed the requirement for double bunk.
We have to be open for 6 months before we can even apply for that, but yeah, they're looking at those requirements.
So we can or we can't.
Depends on what they decide and they have to come evaluate.
Yeah, so you gotta wait 6 months and then put in for it, then they evaluate, and then who knows how long that answer will take. So you're a year out, at least.
Pete, when do you expect your X-ray machine, your scanning machine?
I believe Mike is not here tonight, but I think he got a call that may be delivered next week.
I don't know how many people know it, but we had a pretty good fire up in Coxsackie, the laundromat, a couple of weeks ago. Probably 4 or 5 companies there. It was a double dryer. It caught fire. It was a pretty significant fire inside the building. Ray Femmel was at the station when the call went out, responded in the sheriff's car. Tried to get into the building when his fire with his, little pea shooter fire extinguisher that he's got. He pushed him back out of the building. So he was unable to get to where the fire was to hit it with the extinguisher. But, he didn't stop at that. Coxsackie's first truck showed up, and Ray's also a Carroll fire chief. Pulled their truck driver, told him, go ahead, put a pack on, and Ray pumped the truck for him. Just got that extra guy inside, hit the fire quick, prevented a lot of damage to that building. And they actually replaced the 2 dryers overnight. They were open at 5 o'clock the next morning. So what could have been a very, very bad situation, like he stepped up, took his other hat off, threw the fire chief's hat on, pumped the truck for a little while in a sheriff's uniform. So I appreciate the extra effort.
Thank you. I'll pass that along.
No hesitation.
No,
Now, there's several members who are firefighters, and even if they're not, they're gonna do their best to try and help people.
That's
Yeah,
why
made a
we're in
difference.
uniform.
Good to hear. Thank you.
Thank you.
Thanks, Pete. Deputy Director of Emergency Services, Greene.
Very well. To echo the words of Sheriff Kuzminski, we've also been busy. The problems with the hospitals of being on diversion is causing a problem in the 911 center with ambulances and stacking a lot of calls up in the queue waiting to get an ambulance to service the call for service. September was a busy month. We logged in 2,901 calls. EMS was 613 calls. Fire was 240. And law enforcement calls were 1,231 calls. And then other calls, including public health calls that we transfer up to the thruway, were 817 calls. I started to break down the mutual aid calls and between fire and EMS. This, for the month of September, we did 46 mutual aid EMS calls. That does not take into account of an EMS agency that didn't answer their call. This is strictly the 911 center moving ambulances around to specific locations throughout the county to cover the areas that have depleted their EMS resources. So that's a huge number for mutual aid calls. That includes also Albany County or Columbia County calling in, asking for an ambulance to be relocated to county lines for coverage for their counties because they're depleted. Phone calls, we answered 5,151 phone calls. The sheriff's dedicated line was 399 for a grand total of 5,550 calls. Other than that, we're busy. So, and they're working very hard out there, the dispatchers are. It's not easy trying to find an ambulance. And once that downhill spiral effect starts, it just seems like it just continues and continues for hours on end. So, but we're managing it and managed by crisis. So, questions?
Yeah, what are you looking to do with this from Homeland Security grant that you guys have applied for in one of the resolutions here, 112,000.
The $112,000.
Safety answering point?
Yes, that's the PSAP grant. It's a sustainment grant. It's awarded to us every year, and it's based on call volume. And it's from the previous years. Will be used for services and maintenance on our CAD systems, phone systems, radio systems, et cetera.
Okay.
It's an annual revenue that we.
All right, I wasn't sure if you guys had something new coming up that you were getting into. Anything else?
Thank you.
It's tough to keep up sometimes on the hospitals that are on diversion and for what as well. I think,
Two words before I get
yeah, I think Albany Med tonight is on diversion for psych calls. Like
What's called?
yesterday, the VA was on diversion. The day
Wait
before-
outside.
The day before was CMH, so it moves, it's all over.
Yeah.
It's hard to keep
That's
up.
part of the problem is the ambulance, rather than being 90-minute up and back,
That's right.
2.5, 3 hours as they sit there.
So I can't wait to see the numbers.
Yeah, it's-
Emma.
2 weeks ago, an EMS agency sat in the parking lot of the CMH for 5 hours
Wow.
with a patient at back of the EMS. It's not, they don't have a bed, they don't have a bed capacity.
Yeah, it is.
At hospitals too.
And
And
are they
they're having a
evaluating,
staffing issue as well.
but like, are they evaluating, like, in the ambulance, call and say, this is like a life or death situation, I need to get in there?
They have recommended, CMH has recommended that if you have a trauma victim or a serious medical problem that the ambulance is going to need to go to the hospital, they request that we make a phone call to them and say, hey, listen, we got a more serious trauma victim coming in that needs the attention, like, so they can't sit on the parking lot. So, it's been a task. It's been a task and a challenge. I mean, just to have somebody sit out in an ambulance for 5 hours is
Yeah.
ridiculous.
And we were already facing an ambulance shortage.
Yeah.
So now what, if that ambulance is there for 5 hours,
Don't
that's
get sick.
what
Yeah, right,
happens?
don't get sick.
Well, I heard them call Ulster County, for mutual aid, not available, call Columbia County, not available. They were reaching out to Dutchess County for mutual aid ambulance to come up and stand by for us.
Fine.
On that call with the governor's office, is there a group that, a lobby group or whatever, that represents these hospitals? That may be saying to the governor's office also, why are we imposing these vaccine mandates on our personnel? We're gonna be short-staffed, and explaining we can't take care of the patients, therefore we are, has that been said at all?
Yeah, they actually have. They've had a lot of those meetings. To be honest, Albany Med actually declared a mandate for their employees before the governor's executive order. They came out ahead of time and said, we're gonna require our employees to be vaccinated. So I don't know if they're gonna make much headway there.
Pat, was there any discussion on a letter that we sent?
I haven't received a response at all.
I mean, no talk during the control room?
Not in the control room, our contact, Sam Parker, I mean, he knew it was coming, he acknowledged it, the receipt.
Thank you.
But that was it, no response.
No response. And we sent that last week.
Yeah, and since then, we've all heard the governor on TV. She's not walking back from anything.
No, as I said earlier, she's gonna pick new labor groups and extend the mandate out further. I fully expect mental health to be done.
Sean, are we still, our sales tax still be taken for hospitals, distressed hospitals?
Yes.
And how much has that been so far?
Statewide, it's 250 million.
It's about 360 million or 360,000 for us.
357 or a couple of million.
So in theory, a hospital system like Albany Med makes a horrible business decision to tell its employees that they need to get vaccine.
vaccinated.
Actually, Mike, it's not the horrible decisions, because when I went to the NISAC last month, it was recognized by the states that the hospitals don't need the money. That they're not under financial distress. The theory was when COVID first hit, that they would become under hospital distress, and that's why the money was diverted. NISAC has learned that that's not the case at all. So we're trying to get that rescinded and leave just the AIM payments, the aim to individual municipalities locally only being the remainder. Yeah. Interesting. Haven't used it. Haven't used it. So it's 250 statewide, it's 200 for the city and 50 million for the other 57 counties.
Yeah.
He asked the question, is that money going to roll the state fund balance or whatever? They didn't appreciate the humorous question, I guess.
Okay, closed action items. First one, approving the stop TWI plan for 2022.
Ordinance.
Handle.
Martinez, Handle. All in favor?
Aye.
Opposed? Carried. Second proposed action item is establishing capital project number 119, 2020 emergency management performance grant.
Handle.
Handle, I'll make second it. All in favor?
Aye.
Opposed? Carried. Third one, establish capital project number 120-2021 emergency management performance grant. Lennon. Who seconded it? Okay. Boomer. All in favor?
Aye.
Opposed? So carried. And the final one, number 4, establishing capital project number 121, public safety answering point 2020-21.
Martinez.
Handle.
Martinez, Handle, all in favor?
Aye.
So carried. Opposed? I'd like to make a motion to go in executive session,
Or personnel issues.
personnel issues.
Need a second.
I'll second.
Executive section 638, Hobart Linger.
We've,
We will not order time. I'm sorry.
we've warnings on Zoom. We won't conduct any other.